Anti-malarial drugs. In your syllabus, uh, go through it. So there was no question from this topic, anti-malarial drugs, but it is in your syllabus. It is there, but in the question bank from this topic, there was no question. I have just to go through the question bank. So uh, please go through these slides for your information. So today I'm starting with anti-malarial drugs. Anti-malarial. So first we have to know what is malaria. Malaria is a disease which caused by the protozoa. Here, here the stages by which one by one human to another human is affected by this malaria. Mainly syndrome is rise of temperature. This is caused by the protozoa species is Plasmodium. So this Plasmodium protozoa directly doesn't affect any human body. It needs a vector, and the vector is mosquito. So here this Plasmodium sporozoites, the first vector it is attack the first vector, which is mosquito. Then after biting the affected or the vector mosquito, initial host will be the human host, and from this human, this Plasmodium vivax, either vivax or either falciparum, this protozoa transfer or transmitted into the either placenta or newborn baby, and mainly affected the liver. Liver is infected by this protozoa. Okay. Then after liver is infected, it is goes to the blood, and when mosquito, which is not affected by the Plasmodium protozoa, when the mosquito bites that human, which blood is infected by that protozoa, that mosquito will be the second vector, and like this cycle, the malaria is spread to one human to another human. In this case, mainly liver is affected. After the liver infection, the blood is get affected by that sporozoites or by that Plasmodium species. These are the symptoms of malaria, like systemic fever, central headache, respiratory trouble like dry cough, and nausea, vomiting. It's common. Low gestation, body weight, spontaneous abortion, premature birth, hepatosplenomegalia, back pain, spleen enlargement, sweating, chills. These are the symptoms of malaria. Now this is the species by which, protozoal species by which malaria is caused. This is a Plasmodium species which infect humans. Plasmodium vivax, Plasmodium ovale, Plasmodium falciparum, Plasmodium malariae, Plasmodium knowlesi. The classification of anti-malarial drugs, these are like two types, therapeutic classification and chemical classification. By therapeutically, this is classified, or chemically we can also classify. This is chemically we classified, if chemically we classified this anti-malarial drugs like cinchona alkaloids, quinine, quinidine, then 4-aminoquinolidines, chloroquine, piperaquine, then diaminopyrimidines like trimethamine, 8-aminoquinoline, primaquine, sulfonamides and sulfones, sulfadoxins, dapsones, sesquiterpenes, lactones, that altimeter, quinoline, methanol, mefloquine, tetracyclines like tetracycline, doxycyclines, amino alcohols like halofentrin, then minic base like pyronolidine, naphthoquinone, atrovaquinone, biguanides, proguanil, chlorproguanil. These are the classification based upon the chemical structure. Then therapeutic classification like casual prophylaxis, primary tissue stringonide seasonicides, which destroy the parasites in liver cells and prevent the invasion of erythrocytes, like primaquine and proguanil. Then suppressive prophylaxis. It suppresses the erythrocytic phase and thus attack of malarial fever can be used as prophylactics like chloroquine, proguanil, mefloquine, doxycycline.